Hey guys, welcome back. I'm Em, and today I want to share everything I know about the Golden Retrievers and what health tests they should have prior to being used in a breeding program. Okay, to start us off, I want to talk about the main testing company you're going to hear about here in the US, and that is OFA. And this isn't the only company here that does health testing, but it is the most common one you're going to find. So it's the one I'm going to refer to the most. So for OFA, they do recommend 4 different tests besides the DNA test for Golden Retrievers. And those tests include hips, heart, eyes, and elbows. So for the hips, OFA does require that the dog be over 2 years old in order to have those permanent test scores and be posted on their website. But you can have the test done before the dog turns 2. It's just considered prelims, and those results aren't posted on their website. So OFA scores their hips in 3 passing scores. There is fair, good, and excellent. Anything below fair is considered not passing, and that dog should not be a part of a breeding program. Now, there is another hip test that I do on my dogs, and the reason for that is it tests a different thing than OFA. So OFA is looking at the shape, the position of the hip, the way it fits together, where PennHIP is looking at the stretch in the hip, the laxicity. And so I do prefer to do both tests because that gives me a more in-depth look at the dog's hips. Now for PennHIP, the lower the number, the tighter the hip, and they consider that tighter the hip, the better it is. The breed average is 0.53, so anything around that is kind of considered the normal for Golden Retrievers. However, the lower you get, the better it is. Now with the elbows, OFA does require the dog be over 2 years old for those permanent scores. And again, just like with the hips, if they're under 2, you can still get their test done, but it would be considered a prelim and those results won't get posted on their website. With the elbows, they score them as a normal if they are passing. There's not grades of them, it's just normal or they're not passing. Now for the heart, OFA does require that they are over 12 months old in order to get a clearance. There are 2 types of tests that you can get a clearance with. The first is just the most basic, and it's just the cardiologist listening to the heart. They're listening for any abnormalities and any murmurs. But this, although you get a clearance with it, is not good enough in my opinion for the breed. The other test is a echocardiogram, and with an echo, they are ultrasounding the heart. They're looking at the way the blood moves through the heart. They're looking at the way the heart pumps. They're measuring things. A much more in-depth look. It is a much more expensive test, but it gives you much better insight. And I wish that this was a requirement and they did not offer a clearance with just the basic exam. This test is considered a permanent score once the dog is over 2 years old. However, I'm starting to think that this might be something that should be tested more than once in a dog's lifetime, especially if it's a stud dog that maybe might be having a lot of litters and making a huge impact on the gene pool. So that's my opinion, but the requirement is that the dog is over 12 months old. And if you are wanting a dog from parents that have an echo rather than just a basic, you can see it'll say echo on the title next to that clearance. So I would highly recommend finding dogs from echoed parents and not just the basic exam. Next, we've got the eyes, and with the eyes, it is an annual test. There is no age limit as to when you can do it, but you do have to do this one every year, and this is the one that you'll see the breeder's options in. And I think it's kind of fair because the eyes, this little lady, she scraped her eye on the trail we were hiking the other day, and she scraped one of her eyes, and they're so easy to get injured. So that's why they're giving breeder's option on these. Now, breeder's option basically means that there is a abnormality. They do not think it is genetic. They think that it is just a fluke. And so it is up to the breeder if they want to use that dog in the breeding program. If you do find a dog with the breeder's option on a health test, I do recommend going into their parents, grandparents, siblings, any relatives you can see, and look to see if they also have a breeder's option. And if you can find the breeder's option in other parts of the bloodline, then I personally wouldn't use that dog or get a puppy from that dog, just because if you can trace it, to me, there's a genetic component to it. But that's just my opinion. But with the eyes, that is a test that they do need to be done every single year to keep the dog considered fully health tested. Now, OFA will give what's called a chick number to dogs that have passed those 4 tests. And it's just basically kind of a title saying, hey, we required 4 tests for this breed and they passed all 4. So it's kind of like a little trophy in a way. But that is something you can look for if you're looking at dogs. If they've got a chick number, that's a really good thing. All right, so we had a bit of an intermission and I've got some dogs, they're pupsicles, so they're happy. We're going to talk about the genetic testing or the DNA testing, and this is something that is a pretty easy test to do. I'm going to cover each of these lightly. I'm not going to go into a ton of depth with them, but these first few that I want to talk about, there's 3 categories the dog will fall in. They're either clear, which means they don't have it, they're not affected by it, and they do not carry it genetically to pass off to offspring. There is carrier, which means they don't have it, they're not affected by it, but genetically they carry that mutation that could be passed on to offspring if that dog is not bred to the correct partner. And then there's affected by it, which means that dog is affected by it, they have whatever the disorder is, and they carry the genetic component to pass it on to offspring, again, if not paired with the right partner. Now, what I mean by being paired with the right partner is if you're breeding a clear dog to a clear dog, you're going to get all clear puppies. If you're breeding a clear dog to a carrier dog, you're going to get some carrier, some clear. If you're breeding that clear dog to an affected dog, you're going to get carriers. But if you're breeding carrier to carrier or carrier to affected or whatever, you can see that there's a chance that you will probably end up with puppies being affected. So the reason this is important to know is when you are looking at a breeder, when you're looking for a puppy, look at the parents, and you want to make sure that at least one of those parents is clear for all of these genetic testings. As long as one of the parents is clear, it's not going to be a big deal if your puppy is carrier for it, as long as you're not looking for a breeding dog. As a pet, it's not going to affect them. For this first few that I'm going to talk about, so stay tuned because there are some that you don't want even carrier for. All right, so the first 2 I want to talk about are ICH1 and ICH2, and this is ichthyosis. I think that's how you spell it or say it. I'll put the spelling up on the screen, but basically it's a skin disorder that causes the dog to get dry, flaky skin. It can also cause them to have a little bit of discoloration and sometimes even hardness in some cases, but it's very hit or miss whether the dog shows symptoms or not. Some of them are, if they show symptoms as puppies, sometimes they grow out of it. Some of them don't show symptoms as puppies and then develop it as they get older. Diet has a huge part to play in how bad their symptoms are, as well as grooming. So if you have a dog that is affected by this, they can live with it. Do a really good diet, lots of fatty acids, and really good grooming on a regular basis, and that will help them tremendously. For some reason, this is the one that is most known by people and most asked for when I have puppy families calling in. To me, this one is the most livable one. Like, yes, sometimes it can be uncomfortable for dogs in some cases, but usually it's not. So it's one of those that there are others that I think are way more important, although it is important. I'm not saying it's not. There are others that I feel like are way more important. All right, so the next ones I want to talk about are PRA-1 and PRA-2, and this stands for progressive retinal atrophy, and this is basically affects the light sensor in the dog's eyes, and it will get worse as they age. So as they get older, they'll lose their sight, and most of them will go blind, and this is something that, again, if the dog is carrier or clear for it, that won't affect them at all. If they're affected by it, then this dog has it and they will probably go blind at some point in their life. And the next one I want to talk about is PRA-prcd. Again, this is with the eyes. It stands for progressive rod cone degeneration. I don't know why I can never say that word right. Most of these dogs won't show symptoms until between 3 and 5 years of age. And it usually does cause them to go blind. It starts with their night vision and moves on till they're completely blind. It affects the retina in the back of the eye. And it, again, some of the light sensory there is affected, but it does get worse as the dog ages. So if the dog is affected by this, they will most likely be blind at some point in their life. All right, the next one stands for NCL, and I'm not even going to try to pronounce this one because I know I'll mess it up. So again, put the spelling up for you guys. But basically, this starts when the dog is around 13 months old. It progresses, and most of these dogs that have this will be euthanized between 2 and 3 years of age. It is pretty serious. Basically, they'll start just by losing balance, just simple things, and usually when they're excited, it'll make it a little worse, and it'll eventually progress to the point the dog is losing memory. They're super anxious. They're not themselves. They can even have tremors and seizures and even become really aggressive. So this is something that is not one that you want to mess with either. Again, as long as the dog is either carrier or clear, that dog will be fine. That dog won't have it. All right, so these next two are different from what I've mentioned. So they don't kind of fall. They'll still be clear, carrier, or affected. But with these next ones, they're not as clear cut and as easy to know. So for these next two, I highly recommend both parents be clear from whatever puppy you're getting. Both parents should be clear for these next ones, especially for the MD or the GRMD, which stands for Golden Retriever Muscular Dystrophy. Dystrophy. I've been talking too much, but we'll get through it. And this is the loss of ability to use muscles. Typically, this will show up when the puppies are between 6 and 8 weeks of age, and it's really sad because they'll go from perfectly healthy puppies to they'll lose the ability to walk, to play, and even to swallow. So this is something that will probably affect the dog before it comes to you. But as a responsible pet owner, look for parents that are clear on this. All right, and the last one is DM, and this stands for degenerative myelopathy. I think that's how you say it. This one is kind of confusing because from what I heard, they can, if they have one gene for this, it can affect them. It's not a guarantee, but it could affect the dog later on. And if they have two genes, meaning they're affected by it, they may or may not develop it. So it's not as clear cut as the ones that we talked about first, but if they are clear for it, you should be safe. Your dog shouldn't develop this. But basically, it's a breakdown of the cells in the spine, blocking communication between the brain and the body. So this is not something that you want your dog to end up with. Again, I would make sure both parents are clear for this. Very, very important. I would not breed a carrier or use a carrier for DM in a breeding program at all. You want 100% clear across the board with that. All right, so those are the health tests that are recommended for Golden Retrievers to have done before they are used in a breeding program as of right now. Now, there's always studies going out that are trying to improve our knowledge, and with every litter, the breeder should be trying to improve the breed, not just producing puppies. This may change in a year, but for now, this is what it is. And with that said, my next video is going to talk about how to verify these health tests to know that what the breeder is telling you is actually what the dog is. So stay tuned for that one. Thank you guys so much for watching, and we will catch you in the next one. Have a golden day. And I know she's not a golden, but she's right here. So, boop.